I hate to ruin your weekend just as it's getting started, but we need to talk about Monday. Monday is the last day for open enrollment for anyone who needs an Obamacare or ACA health plan for their health care needs next year. In Oklahoma, around 300,000 people are on ACA plans to help cover the cost of their health care. It's millions more nationwide. And all of those people will not have answers when it comes to any solutions for the skyrocketing prices they are faced with. We've been bringing you stories for weeks now. A vote to change how health care is done in this country in many areas failed in the U.S. Senate yesterday. Next week, we expect more tries to fix health care for all of us, no matter where our coverage comes from. But now there's just talk about doing it next year. The American people are looking for answers on health care reform right now, but at a Christmas party Thursday night, President Donald Trump indicated that health care will likely have to wait until next year.
And I look forward to working with each and every one of you in the coming year to make our nation stronger, safer, wealthier, healthier. And I really believe we can work on health care together and come up with something that's going to be much better.
Monday, December 15th is the final day of open enrollment for Affordable Care Act plans, and those looking to enroll have seen sticker shock this year for what they would have to pay per month in 2026.
What I had to pay was $280 this year per month. And then when I did the calculations in the application, it said that for my continued policy, it would be over $1,200.
Oklahoman Alicia Jarman is one of those facing a hefty price increase. A jump so high, she says she will likely go forward into 2026 without health insurance. And she says it could likely kill her because she won't be able to afford the critical treatment she receives now on her own.
I will be without insurance, and that will most likely result in my death.
Democrats say the solution is simple: expand the subsidies that have been holding prices down for much of the Biden administration and keep things going longer. They are seeking a 3-year simple extension of what's in place right now.
We were not going to support a partisan spending bill that continued to gut the health care of the American people and failed to extend the Affordable Care Act tax credits when tens of millions of Americans are now about to experience dramatically increased health insurance premiums. That's totally unacceptable.
Oklahoma U.S. Senator James Lankford took to the U.S. Senate floor this week and said Democrats were intentionally trying to delay the discussion about health care until 2028, when the next presidential election is, and use it as a big issue to try to reclaim the White House.
But in the short term, let's at least get immediate assistance to those folks that need the help right now by getting dollars to those individuals, not by sending cash to the insurance companies and setting up a political time bomb right before the presidential election.
Lankford and most but not all Republicans voted for the plan endorsed by President Trump that shifts the subsidies to health savings accounts that certain Americans can use to help with copays, prescriptions, medical bills they incur, as well as some of the monthly cost of an ACA plan. That plan, along with the Democrats' plan, both failed in the U.S. Senate.
We do want to assist folks that are stuck in this Obamacare marketplace to try to figure out how do we help them through this. But we don't want to send the dollars to the insurance companies. That's a hole.
Attention now turns to the U.S. House, where Speaker Mike Johnson says there will be no vote on just extending the subsidies, saying the days of big insurance company giveaways are over.
Everybody is coming together on the final plan. We're still working on the final details of it.
Republicans believe this is their moment to offer a legitimate alternative to Obamacare, something they've been debating for the last 15 years, but have presented no solid unified plan on how to fix the American healthcare system. And they will also need some Democratic support.
To me, it's just a basic reality. We need a short-term extension, and then let's talk about some deeper reforms.
Next week is an important week because time is running out to actually get something done. Let's take a look at the calendar for what the rest of the year has in store for Congress. Open enrollment on ACA plans ends at the close of business on Monday, December 15th. The ACA subsidies that are set to expire, that were holding costs down, will expire on December 31st. Congress will adjourn for Christmas and New Year's break sometime between December 18th and possibly all the way up to December 22nd. Hasn't been determined yet, but once they recess for the holidays, they will not come back until early January 2026 after the subsidies have already expired. A lot of people with employer or private insurance plans are also hoping for some relief. Late last month, I had Eastern Oklahoma Congressman Josh Burkeen on the program, who says while Congress is looking at Obamacare and what to do, they know people with employer and or private insurance plans are waiting for their own relief from price and premium increases as well, that many have had passed along to them from their employer.
Look, I don't know if we'll end up calling it Trump Care but yes, there will be reforms that we're going to be voting on. I feel pretty confident about that because, all of us are dealing with this.
Take a look at what the numbers show when it comes to employer and employee plans. Overall, employer health insurance costs are projected to rise about 6.5 to 6.7% next year. This is the highest increase year to year in the 15 years since Obamacare or the ACA was passed. Some employers who don't want to eat more of the costs but will pass along the entire increase to their employees could actually pass along nearly 9% of an increase year over year onto their employees. And then there's another group of Oklahomans whose fate will be decided likely in the spring. Those on Medicaid expansion or sooner care for adults. Inside the big beautiful bill are changes to Medicaid that already passed Congress and puts more of the burden on states to pay for those who enroll in their programs. States have all of 2026 to make adjustments before changes kick in 2027. We do expect more work requirements and other reforms that the Trump administration says will make sure people truly who need this help will get it, and not just able-bodied, lazy, unwilling to work people. Now, before we close out this section, let's go back to the fact that Monday is in fact coming. The last day for ACA open enrollment will come, and we will not have any answers when it comes to those higher prices people have been seeing and expecting for weeks. I have called state and federal leaders and agencies, and I've said, can anybody tell me what should people who are on these plans but can't afford to pay these prices do? And the response was, we don't know. It's possible you could go sign up for a plan, and then after open enrollment, that deadline passes, some relief is passed in the near future. It's possible, not likely, however, if you sign up for a plan, that no help actually comes from Washington. It's best, I've been told, if you need health care next year and you are dependent on an ACA plan, the cost will be higher, but it's better than having nothing. And then when you get sick or need a doctor, be totally on your own. But even then, some people still can't afford it. It's just a bad deal all around.